Is hair loss normal 2 months post-transplant? It's been 2 months and 4 days since my transplant, and I noticed around 10 to 20 hair shafts in my comb. When I am combing my hair after the bath I take once a day, should I worry or is it natural?
Thank you for your question. You stated in your question, which you didn't submit with the photo, but you described that you are now 2 months and 4 days after undergoing hair transplant and that you are noticing approximately 10 to 20 hair shafts per day when you are combing your hair. And your question is, should you be concerned? Well, I can certainly share with you my perspective as someone who performs hair transplant. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers, a system we developed that non-surgically treats men and women with hair loss, and we treat people from around the world using technology that we developed while trying to help our hair transplants heal better. So I think that I think if you were to contact your doctor and ask the same question, they would basically give you the general term of shock loss. And shock loss basically means hairs, whether they're transplanted hairs or even native hairs in the vicinity of the transplanted area, will essentially go early into a phase called telogen, the resting phase, and that is basically they quote shock loss, where the hair sheds and now you have at least 3 to 4 months before there's regrowth. Essentially, with any hair transplant, the time frame of looking for the result to be fully expressed is about a year and sometimes even longer, depending on the growth cycle of the person's hair and the rate of growth. When we were doing a lot of hair transplants, we tried to maximize the outcome in terms of better graft healing as well as donor area healing, and to actually try to minimize shock loss. Because frankly, it is something that even when patients are advised, it can be disconcerting, and people would call all the time. So we trying to see, can we use a technology to help wound healing? So we used something called platelet-rich plasma, which is derived from your own blood, concentration of growth factors for wound healing, as well as a material called acellular matrix or extracellular matrix that is used for wound healing that facilitates the process. And we noticed several things, well, amongst which was that thinning hair became thicker. And from that, we developed this hair regeneration treatment, which basically non-surgically we're able to do injections to help stimulate hair growth of hairs that are not currently growing, thickening thinning hairs, inducing the shed of thinning hairs and growing in thicker hairs, and essentially helping people prolong the growth cycles of their hair and get better coverage of their scalp for longer periods of time. In fact, with our treatment, we've been able to establish that 99% of our patients have improvement that is sustainable for about 5 years. Now, that being said, one of the things that we also were able to accomplish when we were doing this with transplantation is that we were able to get some improvement in the shock loss issue, as well as we noticed earlier growth of the grafts. And so from that, we've actually had a lot of patients come to us from around the world who have had hair transplant and who within the first month to 3 months will come in for a hair regeneration treatment to help stimulate improve their healing process, as well as enhance the regrowth of their existing hair. And what we've observed is that their transplanted hair tends to grow earlier. Now, there is certainly a lot to be understood in terms of the consistency of these outcomes. But the point is that there are methods that can help people along, as we have been able to do for patients who've come to us who learned about our treatment. Because the reality is that not only is hair transplant a challenge in terms of healing of the grafts, but one of the things that is understated, particularly when we're dealing with people who still have a reasonable amount of existing hair, is that there is permanent loss in a lot of those hairs, depending on individual cases, where you don't necessarily get just shock loss, but you can get permanent loss because of the collateral damage from the trauma of surgery, the compromise in vascularity, and other issues. Now, this is not meant to worry you, but it's basically an area that it's an issue that is usually not stated very clearly, because it's difficult to predict how much, quote, collateral loss there will be in an individual patient. So what we have basically developed as a conclusion over the past close to 7 years of doing this hair regeneration treatment is that if someone comes to us, let's say about a month after their transplant surgery, I've been actually able to see from the experience of doing transplants without hair regeneration that the quality of the skin improves, as well as the quality, the growth of the grafts. And the patients have told me, especially those who have had more than one hair transplant, that they didn't have the same experience with shock loss, and their hair grafts grew in sooner. Now, that's, again, anecdotal and definitely open to potential criticism. But as far as your question is concerned, again, speaking to your doctor, you will probably get the general understanding of this being, quote, shock loss. But at the same time, I think you can at least follow your doctor's instructions as to how to best care for your scalp, and realize that the hair that is shed now does not mean that it's necessarily permanently lost. I think that's the take-home message here also, speaking purely from the perspective of a transplant, putting aside the knowledge that we've derived from doing hair regeneration. So again, I think it's very important to maintain communication with your doctor. If you are not sure about something, I would encourage you to see your doctor. You know, with our patients, we always encourage them, regardless of the type of procedure I do, that when in doubt, just come right in so that we can actually see you. It's much easier to help people understand what's going on by physical examination. And so I think maybe that will be what will ultimately help give you some reassurance, but understand that you still have another 10 months or so before you see the full expression of your results. So I hope that was helpful. I wish you the best of luck, and thank you for your question.